Hello everyone. This presentation is on Huang Lian Jie Du Tang, also called Copti's decoction to relieve toxicity. It appears on the California Acupuncture Board examination herbal formula list. I will review its traditional pattern, a short hypothetical patient case, 3 potential drug-herb interactions, and a practical management plan. The purpose is educational. Herbal formulas are selected by pattern, but medication safety still requires attention to pharmacology, dose, duration, and the individual patient. Traditionally, Huang Lian Jie Du Tang is classified under clear heat. A representative pattern is severe heat toxin pattern with high fever, irritability, thirst and a red tongue. Important ingredients include Huang Lian, Huang Qin, Huang Bai, Jie Zai. The key clinical idea is pattern matching. A formula can be appropriate for one patient and inappropriate for another patient with the same biomedical diagnosis. Before treatment, I would also screen for red flags, confirm that urgent biomedical evaluation is not being delayed, and review the exact medication and supplement list. My hypothetical patient is 54-year-old man with metabolic syndrome and recurrent inflammatory skin flares. The current medicines are metformin, atorvastatin, tacrolimus after transplant. This case gives a plausible reason to consider Huang Lian Jie Du Tang, but it also creates interaction questions. I would document the tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about allergies, pregnancy status when relevant, kidney and liver disease, bleeding history, and use of over-the-counter products. Medication reconciliation is essential because many interaction risks come from the combined physiologic effect rather than from one single herb. Interaction 1 is Huang Lian, or berberine plus tacrolimus. The mechanism is, berberine can inhibit CYP3A4 and P-glycoprotein, potentially increasing exposure to narrow therapeutic index drugs. The clinical significance is, potentially high with tacrolimus or cyclosporine because small level changes can cause toxicity. My management plan is, avoid unless the prescribing specialist approves and drug levels can be monitored. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 2 is berberine containing herbs plus metformin. The mechanism is, both can lower blood glucose, producing an additive glucose-lowering effect. The clinical significance is, moderate in diabetes, especially with poor intake or additional glucose-lowering medicines. My management plan is, increase glucose monitoring and review symptoms of hypoglycemia. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 3 is Huang Qin/Huang Lian plus CYP metabolized drugs. The mechanism is, these herbs can affect drug metabolizing enzymes and transporters in experimental data. The clinical significance is, uncertain but potentially relevant for narrow therapeutic index drugs. My management plan is, use conservative dosing and pharmacist review when critical medicines are involved. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. In conclusion, Huang Lian Jie Du Tang may be reasonable when the patient's presentation matches severe heat toxin pattern with high fever, irritability, thirst and a red tongue. The main safety principle is not simply to label herbs as safe or unsafe. Risk depends on the specific herb, preparation, dose, treatment duration, the patient's organ function, and the drugs being taken. I would use a reputable product, start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is for education and does not replace individualized medical care. Key references include the California Acupuncture Board examination formula list, standard Chinese herbal formula texts, such as Bensky and colleagues, Chen and Chen's pharmacology and applications text, and evidence-based drug and herb interaction resources. Thank you.